everyone, you're welcome once again to Creda Birthing Concepts. My name is Ruth and I'm speaking from the UK. I'm a midwife. So this is a continuation of our booking. I think we're lacking behind with the English bit a little bit, so we're gonna just continue the booking with the English session. So with the English, we got to the point where you've gone in to see the midwife and then she has explained the appointments from the booking all the way till you get induced. So we're going to carry on with the rest of the forms and then see where we can get to. So we ask you whether you're married, single, divorced, widowed, country of birth. So if you're not British, then we want to know where you were born. It's all part of the questions that we ask you. And then if you had come from somewhere else into the UK, how long have you been here? Have you been here more than 12 months? This is necessary because in the UK, if you've not been here for more than 12 months, then you don't qualify to get NHS care without, free. You have to pay for it. And then if your documentation is not right as well, if you're not, you don't have the right to stay, the right to partake in public funds, then you cannot have this maternity care free. So we're going to ask you that. If you're coming here or you're here on a husband's visa, then that qualifies you to get free care. So we ask you all these questions so that we make sure that you're getting the right care that you deserve. And then we ask about your religion. If you have any religion, we ask about your partner's name, their date of birth, and their occupation, and their citizenship. And then we ask for telephone numbers. So in case we cannot reach you for some reason, then we can contact your partner to be able to reach you. The other thing that we do is social assessment. So when we say social assessment, the midwife will ask you that whilst you were growing up, was there any social services involvement with you, your parents, or if you have children, is there any social services involvement with the children, or is there any domestic abuse that you want to disclose? So these are all things that the midwife is going to ask you. And then we're going to ask your educational background, your level of education, and can you speak English? Can you understand whatever we're telling you? Can you read the pregnancy note? Are you able to fill the forms and everything? So if you have no problems, English is your first language, then that's fine. But if you're listening to me and you come from another country and you realize that, no, I cannot understand what you're saying, then it is important that you let the midwife know that you don't understand what is happening. So the midwife is she owes you that duty of care to make sure that whatever she's telling you, you understand. So it's really important that if you are not getting it, tell the midwife and we can get interpretation in a language that you understand so that you can be able to make informed choice depending on the information that we're going to give to you. And then we're going to ask what you do. So what you do is really important. If you work in a place where you are lifting things or you are exposed to chemicals or the work that you're doing is not going to be really compatible with pregnancy because of standing too much, sitting too much, lifting heavy weight, or anything that we think is going to impact your pregnancy, then it's really, really important that you have a risk assessment with your boss so that they can move you to a better place or a place where you can be able to enjoy the pregnancy whilst you work as well. Good. And then we ask you simple questions like, do you own your house? Do you rent it? How many people live there? Because we care about overcrowding. We know that when there is too many people in a particular place, then it doesn't allow the children or the baby that is coming into that setting to grow as it should. So we will ask you how many people live in that house. And then we're going to ask you again about whether you're entitled to benefits and all that. We're going to ask you. And then we're going to ask about your support network. So when we say support network, are you new in the area? Have you got parents around? Have you got family around that? If you need any assistance, they will be able to come to your assistance. Or are you just new? You don't know anybody. If that is the situation, then we've got children's centers and all sorts so that we can point you in the right direction. There's no need to be shy about it. If you come, you don't have any support around you, then we can help. Okay, we can help. There are situations whereby you don't have that support, so we have to even get things like social services to put extra support. I know most people, when they hear about social services, all they think about, oh, they're going to take my baby. No, they do more than that. They can put support in place so that it can help you to actually keep your baby. So if you need support, you need to let us know. And then we'll do something about, we'll ask you about your smoking position. Where are you? Are you a smoker? Are you a non-smoker? Have you ever smoked? Or have you smoked and you've stopped because you found out that you're pregnant? So we do all these things knowing that sometimes when you want to do things by yourself, it's really difficult. So if we realize that you were a smoker, you have stopped, you're flagging a bit, but you are thinking of this baby and you don't want to go back to smoking, then the midwife can refer you to smoking cessation. They can help you with patches and gums and lozenges and things that will help you to gradually get over the habit of smoking. So we're going to ask you that as well. And normally we do a CO reading. So we look at the CO levels in your lungs. We give you a little tube for you to blow into it. If you blow more than 4 and you're a non-smoker, then we are a bit skeptical what is happening. Have you got a faulty boiler, or are you having a second-hand smoke from somebody else who lives in the household who smokes? So we look at all these things and then make sure that the necessary help is put in place. And then we ask about substance use as well. Have you used cannabis before? Cocaine, amphetamines, shisha? If it's anything that you've used in the past, we call something historical use. If it's historical use, just let us know. If it's something that you're using currently and you're not able to get over it, we need to know that as well so that we can put help in place for you. And then we ask you about your alcohol intake. So since you need a life before pregnancy, you need a life. So we ask you before pregnancy, how much alcohol were you taking? So normally if you take the small glass of wine, that's 3 units. And if you take the bigger glass of wine, then that is 6 units. If you're taking the bottles, then we're into 10 units. As long as you found out that you're pregnant, you stop drinking, then that's fine. There is a condition called fetal alcohol syndrome, which is not a very good syndrome for babies. So we don't know when these babies get this condition. Somebody can be pregnant and drink throughout and everything will be fine, and somebody could just have one drink and it will not be fine. So we just encourage you to stop drinking altogether when you get pregnant. So that we're going to ask you. And we ask about your ethnicity as well, where you come from. So when we say ethnicity, it's your roots. For me, I am a black British. So there is some blackness in me, and then I'm British. So when we ask you these things, we're not trying to trick you or anything like that. There is a reason for that, because people of some ethnic minority roots have got the risk of diabetes. So we ask these things so that it can help us to plan the care that we are about to give you. So that is what it's all about. So we're going on to medical questions so it's like medical history, the things that we need to know if you had them before, if you're currently having them, so that we can be able to plan the care. So the first one will be to ask you whether you've had any admissions to A&E in the last 12 months and what took you there. Was it a very serious condition? If it was, let us know what happened. If it's just a simple headache or something like that, then that's fine. And then we ask about any admission to intensive care unit or high dependency unit. Were you giving blood? Whatever happened, we just need to know so that we can be able to have a clearer picture of who you are. We ask about anesthetic problems. Have you ever had any operations in your life? And when you had the operations, did you react to the anesthesia? So we need to know. Any allergies? As I always say, back home in Ghana, I've heard the word allergy, but I didn't make much of it because I didn't even know anybody in Ghana who had an allergy. Most of the time, a little itchiness when you take chloroquine. But I came into this country and I realized that allergy is a massive thing. So if you have any allergy, something simple as pollen, which gives you hay fever, it is really necessary that you tell us, and then we'll write it all down. And as big as penicillin and all that. So when we talk about allergy, we're talking about food allergy and drug allergy. And if you're listening to me and you think you've got an allergy to something, you need to find out. Most of the time people come in like, oh, my mother said it was my childhood. So they don't know what it is. Is it a reaction or is it a proper allergy? When we say a reaction, like you take chloroquine, for example, and then you have a bit of itchiness, that is a reaction. But when we say allergy, you've taken something and then you're swelling up, you can't breathe, your whole face is gone blue and purple, and your organs are failing. So if you've got anything like that, we really need to know, and you need to know the reactions, what happens when you take those things. And the next one on here is autoimmune disease, so Parkinson's, rheumatoid arthritis, things like that. If you've got anything like that, you need to let us know. So with conditions like this, you're definitely going to be under consultant care so that we can keep an extra eye on you. We ask about any blood clotting disorders. Is there any blood clotting disorders in the family? Have you yourself had any blood clotting issues before? We need to know that. Is there any cancer in the in yourself? Have you had any cancer in the past or currently that we need to know about? Cardiac problems is very important because as the baby grows in the uterus, it pushes most of your organs, the lungs and the heart, it pushes them up. So if you already have a heart problem, then it can be compromised as the baby grows. So we need to know that. And then we ask you about your smear test. So if you're listening to me, you're in the UK, you're more than 25 years old, you've never had a smear test, go to your GP surgery, find out why have I not got an appointment for that, and then they will book you in. Normally, when you do the first one, every 3 years you get a letter to remind you to do it. So if you've never done it, you're more than 25, go to your GP surgery, book it and get it done. If you've done it before, your letter came and you couldn't honor it, go back, do it and get back in line so that every 3 years you'll be reminded. The next one on here is chickenpox. So we ask you whether you've got chickenpox before or you've had a history of it. So if you do, then that's fine. You've got antibodies in your system. But I am not saying that if you hear somebody's got chickenpox, then you can just go and have a chickenpox party. No. Chickenpox in the early stages of pregnancy and the end stages of pregnancy is really dangerous time to come into contact with it. So if you've had it before, you've got the antibodies, but still be very careful. If you've never had chickenpox, if you're pregnant, the early stages of pregnancy and end stages of pregnancy, you hear somebody's got chickenpox, please don't go near them, okay? And then if you are a teacher or you happen to socialize in circles where there are children and they've got this parvovirus going around and you don't know whether you've got immunity or not, then you have to go to your GP and just explain the situation to them. They'll just do a blood test to make sure that you are covered. Yeah, good. The next one on here is diabetes. So if you are type 2 diabetic already, we need to know. Or if you've had previous pregnancies where you've had diabetes, then we need to know. If there's a history of diabetes in your immediate family, your mom, your dad, then we need your siblings, sisters and that, then we need to know so that we can put the appropriate care in place. The next one on here is epilepsy and any condition, ongoing medical condition that you have. And the other thing to add here is if you're already on any medication and you get pregnant, it's very, very important that you go to see the GP as quickly as possible to say that I am on this medication and I've noticed that I'm pregnant. Is this safe for pregnancy? Should I carry on? So the GPs will normally sit down with you and then look at the medicines that you're on and then find one that is really compatible with pregnancy so that you don't harm the baby. Some medications we do know that are not very compatible with pregnancy, and if you continue on them, will give baby some form of abnormality. So we encourage you to see your GP to make sure that your medication is reviewed. And we ask whether you've been exposed to toxic substances. So if you work in an environment that you use chemicals that inhaling them in and out will not be safe for your pregnancy, then you need to do that risk assessment and move out of that environment. Fertility problems. So some people can get pregnant easily, other people will have to struggle. If it's IVF, whatever form, let us know so that we plan the care appropriately. So female circumcision, most people know it as cutting, and so many of our population don't know about this. I was born in Ghana. I heard a little bit about it in Ghana, but I didn't know what it was until I came into this country and started training as a midwife. So what I am trying to say here is that female genital mutilation, it's a crime in the UK. So if you're coming from other cultures where you think this is what they do, in this country it's a crime. If you do it, you will be found out and then you'll be arrested and you can be jailed. You will be jailed if it's found out you've done it in this day and age. So if you are coming to see the midwife and you've got a history of this, it's really important that you tell the midwife, I've got this. There are so many grades of it. Grade 1, grade 2, grade 3, where they take away the clitoris, that top, they cut it all off and then they stitch the vagina close so there's no space at the top. If you need a wee, the wee will have to go through the stitches behind and come out of the vagina wall. And then when you go to have a baby, this whole thing will have to open up for the baby to come out. It's not a very nice experience. I think it's so barbaric, and I think it should never, ever be done to another girl in our world anymore. So if you have it, just let us know. We'll do the necessary paperwork. We will educate you to let you know that this is not right. And in case you know it's not right, but you take your child on holiday and your grandmother or somebody does this to your little girl, you will go to prison. So it's really important that you protect your female children if you've had it, especially when you're going back home to your various countries where this is practiced. You make sure that you keep an eye on these children. You don't leave them on their own, so that a grandmother who doesn't still understand that this is a crime to do that to your child. So please, 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 if you've had cutting, just tell us and we will support you in the right places. Thank you. The next one on here is gastrointestinal problems like colitis and Crohn's disease and anything to do with the gastro, yeah? So let us know, because when you're pregnant, you need all the nutrients so that it can feed the baby, go back and forth and work beautifully. So if that is not working, then we need to put other measures in place so that the baby is monitored and make sure that everything is fine. We look at genital infections like chlamydia, herpes, and anything that syphilis, HIV. We look at all those things. So the midwife is going to screen you for a few of them. But if you've got herpes, for example, is like the normal cold sore that we get on our lips. So if you are somebody whose sexual life involves a lot of oral sex, if you have the cold sore on your lips, please don't do oral sex. Don't put your mouth down below. The thing is, if you do have flare-ups, so it's not always there. That's the herpes. It's not always there, but sometimes you have flare-ups. So if you go into labor and there's a flare-up, then unfortunately you will need to have a cesarean. So let us know. Don't be shy about it. Let us know. The next one on here is we ask you about your gynae history and operations. If this is your second baby, you've had a cesarean or normal delivery, we just need to know the date of birth, the weight of the baby, how many weeks pregnant you were, and then if there was anything like bleeding, any major thing, preeclampsia, diabetes during the pregnancy, just let us know. Okay, good. The next one on here is hematological disorders like sickle cell, thalassemia. We're going to do the blood test anyway, but if you also know that you have it, just tell us so that we'll be forewarned. And then when the bloods come back and we have to do your partner or your husband, then we will have to do that. Okay, good. The next one on here is high blood pressure. Is there any history of high blood pressure with you? Have you got one already which is chronic? Or did you have one when you were pregnant in a previous pregnancy, transient? Anything, just let us know so that we can. And then is there a history of it in the family? Because if there was or there is, then there is a risk of preeclampsia, so that we can plan and put things in place. The other one is incontinence. So when it comes to incontinence, this is where I encourage you to do your pelvic floor exercise. As a woman, you can never stop doing it. You do it for life. So you have to do it. There are a lot of apps now. We call something the Squeezy app. It helps you, remind you to get your pelvic floor exercise going. So it's really important. So if you come to see the midwife and at the moment you're only 8-9 weeks pregnant and you can't even hold urine at this stage in pregnancy, then we need to refer you so that we can give you the necessary help that you need. Yeah. The next thing on here is we're talking about infections, MRSA, Group B, strep. So if you've ever had MRSA infection and you're cleared, then that's fine. Towards the end of the pregnancy, we're going to do an MRSA screening anyway to see if it's still there or gone. If we do it and you have it, then the GP will give you antibiotics to treat it. But something like Group B strep is in all sorts of places. It's a bacteria that we live with. It's good bacteria. It doesn't do any harm to us, but it's not, the babies cannot tolerate it very well. So if you go to see your midwife or you give urine sample, vaginal swab, and then we find out you've got Group B strep, the plan will be that when you go into labor, we'll give you antibiotics. So with you, if in case your waters break before you go into labor, straight away wherever you are, you call your labor ward unit so that they can start giving you the antibiotics. Because when the waters are intact, the baby is protected. The moment the water goes, the protection is gone. So we need to start doing things so that the baby doesn't get infected. And whether you had antibiotics in labor, you also went before labor, whatever happens, the babies, when they are born, if you have Group B strep, the babies will be monitored to make sure that they haven't attracted any infection. So be prepared to stay in for a bit longer if you are Group B strep positive, because the baby will need to be on observations. The next one is we ask about any inherited disorders, anything in the family that everybody has got, any inheritance through the ancestry line, then we need to know. The next one is liver disease, that's hepatitis, got the B, C. So if you have it, let us know. Like if you've got Hep B, what we normally do is we do a baby alert to say that when this baby is born, it will have to have Hep B vaccination within 24 hours of birth. So just let us know. We'll do all that, put that in place, and then the injections, they continue, I think, till the baby is a year old to make sure that the baby is well protected. The next one on here is if you're having severe headache and migraines, when you come to see the midwife, you need to let us know. Yeah. So if it's ongoing, that the GP knows you're on medication for it. It's not, oh, I had a little headache yesterday. No, we mean ongoing migraine and severe headaches. And sometimes when you get pregnant, you get a lot of headaches, which is normally frontal headache. This is due to you not hydrating enough. So if you're drinking enough, you're drinking well, and you feel like I've still got this headache going and you cannot understand it, then you need to talk to your GP. But in pregnancy, you can take paracetamol. That is the only medication that you can take that is safe in pregnancy. We also ask you about any musculoskeletal problems. Have you got plates in your legs or back or screws anywhere? Just let us know so that we can plan for the care. We ask for any operations that you've done. We ask for any pelvic injury around the pelvic area. This is necessary so that if you've had an accident that has altered your pelvic and you cannot have a normal delivery, then all the care will be put in place. And then we ask about renal disease, any urine problem, anything to do with your kidneys. We ask about respiratory disease like asthma and how severe it is. Are you on inhalers? What color inhalers you're on, how often you're taking them. And sometimes we ask you whether you can take ibuprofen. Some people with asthma can never take ibuprofen and others can take it, because when you have a baby, the two drug of choice is paracetamol and ibuprofen. So that if you've got severe asthma, we know you can have ibuprofen, then it's noted and written down. And the other one is we ask whether you've had any exposure to tuberculosis and blood clots. We've mentioned that. And then we ask if you've got any thyroid problems. Thyroid help us to be able to metabolize the food and everything. If you have low or high thyroid, then there is a problem there. So we need to know so that we can put the plan in place. We ask about any medications that you are on, any medications in the last 6 months. And then we again ask you about any bleeding since the last period. And then we ask you whether you are on folic acid. Was it before the pregnancy or when you found out? So if your BMI is under 30, then you can have the usual folic acid that is sold on the market. That is the 400 micrograms. But if your BMI is more than 30, you need to go to your GP to prescribe you a 5 milligram folic acid. So if you're listening to me and you've not even seen your midwife yet, and you're pregnant and you know that your BMI is more than 30, please go and see the GP. They understand. They will even prescribe it for you before you come to see the midwife, which is a very good thing to do. But the thing is, you cannot buy 5 milligram over the counter, so you need to see a GP. Thank you. The next one on here is we ask about the family history. So that is yourself and your husband. We ask about thrombosis, diabetes, hip defects from birth, heart defects from birth. And then we ask if you and the baby's dad are blood relation, first cousin, second cousins, and things like that. We ask if there are any diseases that runs in both families and the need for genetic counseling. We ask for stillbirth and multiple miscarriages. If you've had more than 3 miscarriages, then it's very significant that you tell us. Any sudden infant death in the family. And then we ask about learning difficulties. We ask about hearing loss from childhood in the family. And then heart or hip problems from birth. So these are all questions that the midwife is going to ask you to make sure that everything is going on well. And again, we're going to ask you about consent. So because your care is going to be by the midwife, the GP, and sometimes the consultant, we seek your consent to say that everything that we are asking, you're going to put it on the computer. The midwife who is booking can look at it. If the midwife is not in clinic on the day, then whoever is having the clinic will see or will have access to this information. This is all to do with the Data Protection Act. So we need you to consent to that. And as we said earlier, you have 2 scans, the dating scan and the anomaly scan. So these are the 2 that you will have. From 26 weeks, we start measuring the baby with a measuring tape. If the baby is too big or too small, then you will have to go for extra scans. So I think this is where we're going to end today. And then next week, we're going to finish on the screening or look into the minor disorders in pregnancy. Look at all those little things that is very annoying, but it's part of pregnancy that there's nothing you can do about. So thank you for watching. And as we always say, if you're very happy with what you've heard today, you can share our link or you can get your friends to listen to it and subscribe so that every time we put new material on the website, then you can just see it straight away and get some education. So thank you for watching. It's been me, Ruth Nyarko, midwife, and you've been listening to me from Creed Birthing Concepts. Thank you so much. Thank you.